Hi, it's Dr. Andy. Now, I want to show you a couple of things about back pain because keep it simple, stupid is a good way to go about things with back pain. The KISS principle. I'm going to talk about low back pain in this video, which is the commonest cause of back, or the commonest area of back pain where patients come to the doctor. So, first of all, differentiate what is most likely causing the pain before we figure out what exercises to do. And a simple way to do that, not foolproof, none of this is foolproof. And, by all means, go see your doctor, of course, especially getting a little bit ahead of myself. But if you're getting pain that radiates down your buttock, your thigh, if it goes beyond your knee, you must go to your doctor and get it checked. So all you do, first of all, is a little differentiation. Bend forward at the waist, see if it hurts. Bend arch backwards at the waist, see if it hurts. If it hurts bending forward, then it's most likely your disc that's hurting. Because the discs tend to push out backwards a bit, and so when you bend forward, it pushes them out more. If it hurts bending backwards, it's probably, but not foolproof, probably a thing called a facet joint problem. And they're the little accessory joints that stabilize the spine, one vertebra on top of the other, as opposed to the disc, which is like a bit of cartilage in between the vertebrae, each of them, which acts like a shock absorber. But the facet joints, they're just a little one bone like that. They join, or they meet in a joint. They can jam up, and it hurts to go back if that's the case. So the principle is, if it hurts to go forward, don't go forward. If it hurts to go back, don't go back, as far as the treatment goes. So when you're doing some exercises of this, and they're very helpful, let's talk about the going forward one hurting, which will be your disc, most likely, that you've hurt. And they get better, and vast majority of them get better if you do the right thing. So I'll show you what to do for disc pain. So you lie on the floor, like so, and just come up a little bit, just onto your elbows, just as though you're playing with the kids or something, or the dog or whatever. Like that, if you can, if your pain will allow you. Sometimes it's not, you might much too much and you just need to just stay lying flat on your stomach. Lying on your stomach is very helpful for disc pain, the one that hurts going forward, very helpful. Sitting is really bad. Standing's better than sitting. So lie on your stomach, and then when your pain allows, just come up onto your elbows and stay there for as long as you can tolerate, really. See, I'm wiggling my hips around, but you won't be able to do that when your back's fiery. But just do that as it feels good, should feel good. And then as your pain allows, come up higher. So you might be able to come up a little bit more, like that. And you always keep your head looking forward, straight ahead. And then you might be able to get right up and looking straight ahead, like that. That's really good for disc problems, super good. So that's the main one, but don't go too crazy. Start just lying down. If your back is red hot, lie down on your stomach. That's it. Spend a lot of time lying on your stomach. And then gradually come up a little bit. And then that's that one. And then another one that you can do kind of day to day, every time you get up from sitting, arch backwards. So just come back like that. As soon as if you've been sitting down, arch backwards. Okay. That's really, really helpful as well, that arching extension. I'll just talk about the facet joint pain, and then we'll stop this video because I don't want to be too long and boring. So the facet joint, the little joints between one vertebra and the other, one underneath, one little bit of bone comes down from on each side and forms a stabilizing joint. They lock up, called facet joint pain or facet joint syndrome. So the treatment for that, hurts going back, so we don't go back. we kind of go forward, but don't treat it by going forward here. You might end up hurting your disc. Get on the floor and the other thing with facet joint pain, it's usually a little bit one-sided or very much one-sided. Disc pain tends to be in the middle. But the facet joint one, it hurts to go backwards, it'll tend to be on one side. So let's just say it's a bit more on your left side. You're going to be flexing, like we said, so you're going to lift your left leg up, like so, keeping your lower leg horizontal to the floor. A principle to remember with back pain, always move away from the pain. If you think about what I was doing with the flexion test, move away from it. Extension exercises. If extension hurts, do like sort of flexing but on the floor. And if it's hurting on the left side, move to the right with the exercise. So you lift the left leg up, keep your shoulder, if it's the left side, keep the left shoulder on the floor, and take your leg across the other side like that. It feels good. And it's very good for that pain, very good. Just stay there for a while like that. And you might also want to bring both your legs up like so, and take them across like that. And stay there. That feels really comfortable. Both of those exercises I've just shown you. Okay, so it's 6 minutes and 45 seconds, which is a long time. And good luck with that. Love y'all.